The other thing was I kept telling people that with all the great music going and everything, they don't want me to come up here sooner and have to start singing or something until they gave me the signal that they had internet access. And I was talking to this table over here, and I was like, I used to be a jazzercise instructor. We could do some jazzercise. It's like, not in the morning. So I hope you had an opportunity to talk with people at your table, and we tried to mix you up, so hopefully you got to meet some new people. And it was a great conversation as I was walking around. So again, thank you all for being here. We're going to start off, first of all, with our board chair, Rob McCray. He's been our board chair actually the whole time I've been here, which is a whole year and a half. But Rob McCray is also the executive director of the Wireless Life Sciences Alliance. There you go. So welcome, Rob McCray.
Good morning. How is everybody? So this is our fourth conference, innovation conference, and it is great to see all of you here. I think you're all principals this year, and in the sense that you're all in the business, quote unquote, of serving the clients and patients and citizens that we all care about. So I'm just going to make a few brief remarks. Last year, I think I described how we restructured our operations and grant making to simplify, to lower our overhead and enable us to reduce our expenses by about 50% and increase our ability to commit to you and to our citizens here in San Diego and Imperial County by the same amount. This year, I just have a few general comments to make and kind of return to a few questions that have come up in the past and continue to recur. First, we have a number of our board members here. They're spread around the audience. I'll just call out Stan Lewis, who joined the board after long serving as a volunteer in the program committee, and Stan, I know, is here. There's Stan. And Dr. Rodney Hood joined our program committee this year. He's been helping us in the selection process for the Innovation Award for the last, since inception. And he's joined our program committee this year, which is a starting point that we use to get people interested and involved with us at the board level. The board is, like myself, really committed to healthcare in most of our daytime jobs as well as volunteers. So we are committed to it. We want to do the right thing. We know it is a journey, and you are our partners in that journey because while we both share a focus on our beneficiaries, our citizens, our consumers, our patients, we can't deal directly with them. In a sense, you in the room are the instruments that we use. So you are our partners. We can't do anything without your good work. So we appreciate you coming here and working with us to help figure out how to do the best with the limited resources that we have. I guess in terms of our focus, let me just return to comments that we've made in the past. We're the Alliance Healthcare Foundation, but if you look at our mission from day one, 20 years ago, it was to promote the health and wellness of the needy residents of our community. And so I'm going to call for a show of hands. How many of you are from the sort of healthcare or provider side of the equation? And how many from social services? So pretty evenly split, maybe a little more provider. That's the mix we're looking for. You are equally important. This is not about healthcare. It's really about health of citizens. That's what we want as people. We want healthcare is something that we need in order to get back to what we really want. So it is a necessary instrument, but given our focus on trying to use our dollars to really make a change, not just help people for the next few months or a year or two, but really to make a change. Keeping in mind that focus is on how do we improve the elements of health long term. small amounts of money to make big changes and to lever big long-term changes. But that is our focus. Innovation is a word that gets used a lot. It's caused a lot of confusion. I think our first year for the Innovation Award, a lot of people thought, well, it has to be technology. I mean, how can I compete with Qualcomm and electrical engineers and all these people that are creating amazing technologies or applications? And that is not what innovation is about in our view. It may use technology, and certainly it does. And we, in our first year, we gave a grant to Text for Baby. And one level using a mobile phone and texting, SMS texting is using technology, but it's not about the technology. That's just something that we all have. And we were using it to see how we could do messaging to improve health outcomes. And so that's an example of an innovative approach, bringing a new technology that was readily available and cheap, virtually free, into a healthcare or social service setting and using it. So that's an example of innovation that we've funded in the past. And so innovation does not have to be technology enabled. It may be, often it is. It doesn't have to be. But think of it as you're thinking of how to come up with ideas, how to work in your own organizations, whether or not you apply to us for a grant. Innovation really is coming up with a different approach to solving a problem. And it may be a change in workflow or process or who you focus on. The hotspotting concept where you have a limited amount of resources and you focus on the people that are costing the most, using the most resources, limited resources. That's innovative. The Philadelphia program, housing, some of these folks. And we're not about, homeless is just one of many populations that we have dealt with. So I don't want to give you the wrong impression that itself is a major focus. But there are examples of approaches that were innovative but not tech-enabled at all. And that's why I wanted to mention those. So this concept of innovation and the Innovation Award that we look to make is open to everyone that is committed to the sector and wants to do a good thing for our citizens. Think about it another way, and we are starting in 2014, adding about 30 million Americans to at least the theoretical insurance rules, covered rules. We're not expanding our capacity to provide health care for those people. You all know that are in health care. So, how is that going to be meaningful? We need to innovate, to create new ways to use the existing resources to cover this additional demand. Because there will be more demand as a result of this coverage. So there's a key area for innovation that is really focused on healthcare providers and on the social service agencies. Some of the markets, the Medicare market is already facing this with hospitals suddenly paying attention to the readmission issue because Medicare has changed their reimbursement rules, and now hospitals aren't being reimbursed for all of the readmissions of patients that leave with a certain kinds of diagnosis. And some of the solutions that hospitals are doing to meet that need involve better coordination with social service agencies. And so, there's an opportunity for collaboration. It is driven by economic changes and demand in the country that are real and that, trump politics. Because when you're going broke, it tends to get both parties attentive, and maybe in the wrong way. But we do have a challenge. We have the opportunity to serve more people and to have payments for that. But at the same time, we're not creating new clinics, new doctors, new resources. We have to expand capacity pretty much with the resources that we have. So think of that and think of how do you bend the demand curve for health care. And that's, if you think of, teaching a person how to fish, not just giving them something to eat, if we can bend the demand curve. We can help our clients, our citizens, take better care of themselves, become more responsible for their own health and families, have better access to some of the determinants of health other than health care. We can reduce their need for healthcare services. That also requires innovation. And I can tell you in the broader society that I deal with, in sort of the connected health world, there is a lot of excitement. There's a lot of 20-somethings who have decided that health is cool. I have a few slides that maybe if we have time, I'll just show you. And that's really a good thing. A lot of what they do is going to be thrown against the wall and just slide down onto the floor and it won't do anything. But there's tremendous energy in that. And the notion that you do get this generation of kids, highly trained kids, highly motivated kids, thinking that, wow, health on a global basis is a place where you want to work. Not just because you want to do good, but because you want to do well for yourself. But bringing that combination together, there's a cool factor going on that you see in the cities and in tech centers that I think is good. It bodes well for us in the long run. So let me show let me just click through a few slides if I can get the right one here. So this is the world I deal with. I don't think this slide's going to transition, but it's, there's digital health, wireless health, mobile health, m-health, electronic health, e-health, connected health, which is probably my favorite term. At the end of the day, if this slide still transition, which it won't, I think, at the center it's health, because that's really all the patients and citizens care about. That's what they want. They don't care how it gets there. These other things are just tools. And well, there it goes. It worked, Nancy. And that's what we care about. Often I'm talking to tech crowds, and they get focused on what they do, and we can all do that, right? Get focused on what we do, not on what the goal is. And the goal, I just want to emphasize, is health. One of my good friends is Chief System Medical Officer in the Memorial Hermann System, biggest nonprofit, biggest system of any sort in Texas, very large regional provider in the Houston area. They changed their name from Memorial Hermann Healthcare System to Memorial Hermann Health System. And that was part of their commitment to changing how they deliver services and what they do. The former CEOs of each of their hospitals, and they have like 9 of them, are now chief operating officers. They have operational responsibility. They don't have P&L responsibility. They're not supposed to drive profits. They're supposed to drive efficient operations. And that means that if they make a commitment to reduce readmissions, even though they can still make money on readmissions, they're going to do it. And that's something that's happening in the real world beyond us that will help our community. And there's about 800,000, talking to Nick Manchion yesterday, 800,000 people in the county now follow his programs, which pretty much maps to what we're all concerned with. The reason I'm looking over my shoulder is because this isn't the same deck on this computer. So just a few slides. This is why the rest of the world, the wealthy world in the U.S. and beyond is paying attention to the need to innovate in health and health care. Aging, chronic disease, that's kind of hard to read on this deck. Chronic disease is increasing. Of course, it increases with age, and it's just increasing because we're eating ourselves to death in many rich countries. At the same time, when you get older, you need more doctors. As you get sicker, you need more doctors. We're not producing the doctors. The bottom curve there is the growth in physicians, and the top two curves are total population. The highest one is the population over 65. So we're getting farther behind in the whole community. The Institutes of Medicine published a report about 4 months ago now, and they found what they said was $750 billion per year in essentially medical waste in U.S. healthcare spending annually. And remember in that presidential election we had recently, the candidates were fighting over whether or not they could, we could save, a few $100 billion over 10 years. And here, a group of experts led by Mark Smith, the head of the California Healthcare Foundation, said we can find much more than that every year if we, approach things differently. That sort of thing gets everyone's attention. The Milken Institute is a nonprofit institute. They came up looked at it from a different approach, but just looked at unnecessary services, avoidable services, things that can be done by changing how services are delivered and to some extent how they're demanded. There are many, many studies, lots of organizations focused on this issue, and they're attentive now because, I've been around healthcare forever, and we've been talking about this forever, but now there's an interest in it because in this country, the only long-term budget deficit issue we have is Medicare and Medicaid spending. We don't have any issue in everything else, and everyone sort of tumbles to that. So there is sort of getting some power behind the notion that we have to come up with better ways to engage with citizens so that we can, bend this demand curve, help us stay healthier, and that's a real challenge. And at the same time, reallocate our resources in healthcare, perhaps, including chipping away the fee-for-service transactional medicine system and changing incentives to free up dollars for true need. And I show this one because this came out just in March, John, the Internal Medicine report, and this gets right at everybody. There have been previous studies that show that life expectancy in the United States, the richest country in the world, the richest big country in the world, life expectancies for certain low-educated demographics is actually declining now, starting showing some indications of decline after, obviously decades of increase. This study reports that baby boomers, my generation here, may on average live longer than our parents, but we will be living unhealthier lives, more chronic disease. So you just put the growth in chronic disease together with increasing life expectancy, you can kind of get here. They've found more true evidence to support that, and that has gotten people really scared. Organizations of all sorts. We have, again, I deal with a world of companies and research funding organizations and research organizations in my day job, and the notion that there is a remarkable need and a remarkable market for change in health and healthcare is being embraced by that, and that is a good thing because you can say, well, our population, we're at the tail end of this, that doesn't help us, but it can and it does. And often in healthcare, unfortunately, technology makes everything more expensive, not less. I think connected health has the promise of actually delivering savings, and the need to change how we spend and how we pay for healthcare, I'm optimistic is actually going to produce changes that will benefit the people that we are worried about and caring for. Just as consumer electronics technologies start expensive, they get cheaper. We're trying to bring that concept to healthcare, and because we can get discouraged, right? We get cynical after being in it for so many years that it's not going to change; it's just getting worse. Obviously, we wouldn't be in this room if we didn't think we could do something to benefit, but we do. And so I'll just I'll skip over. This is just some of the many technologies that are out there. A number of these companies are local, but kind of close with this one because a lot of people think, well, we can't get better. And granted, the automobile industry and driving is not nearly as complex as health and healthcare, and it never will be. But it does share some similarities. Transportation depends heavily on government investment. It's highly regulated. It's a consumer sector that other people pay for. The outcomes are partially a result of technology and partially a result of behavior, like drinking and drugs, not good for driving safety. And I show this slide because that car on the left is the one I had in college, and the one on the right is the one that I would buy for my college-age daughter today if I were to spend basically the same amount of money in real term dollars. And which one is safer? Which one is more convenient? Which one, population-wise, we've decreased, despite a lot of social issues running against the trend. And drinking and drugs at younger and younger ages is probably key. Despite that, we've reduced the fatality rates dramatically over this time, while transportation has gotten cheaper and safer and better and more convenient. So I think we can do that in healthcare and health, and I think that San Diego is a place where we can start that. We have a county that is committed to this. We have a health information exchange being developed, and I'm hoping attempt number 4 or 5 is the one that's going to be a success. We are promoting and funding the development of a social service information, the CIE, Community Information Exchange, to try to link up with that, bring the same sort of visibility. So I'm optimistic. I think we can do it with your help and innovation. So thank you very much, and I'm going to bring Nancy back up to run the rest of the day.
We could go to the next slide. Next slide, maybe. It's me. So anyway, thank you, Rob. It was a great way to kind of start us off and begin to look at what's innovative, what have we done in the past that we've funded, paint kind of the dreary picture about what the challenges out there and what we all know, but something that we can begin to start thinking about as we kick off this day. I also noticed that we have a few other of our board members here, so I wanted to also introduce you to them. Over here to my left is Dwight Smith. Stand up, Dwight. I don't know exactly where everybody is, but I know Joe Ramsdale, Dr. Joe Ramsdale is right here. Elizabeth Dreiser, I see you in the back. And Rosemary, there she is, Rosemary Johnson here, Dr. Rosemary Johnson. So, great to have some of my board members here. Also, I wanted to introduce you to James Bobo, who's back here at table number 5. He sits on our audit committee. Great to have you here as well. So I also wanted to say, as Rob said, innovation isn't always technology. But there are definitely ways to be innovative in different realms of the work that we do. And one of the things that I've tried to bring to the organization and to all of y'all is how to be innovative there it is, okay, on social media. So we've been trying all different kinds of things to get the message out. I've also been on my phone looking at Twitter as well as Facebook, and some of y'all are posting messages. I really appreciate that. You can always Twitter at Alliance AHF. You can send a message there. Y'all can do it all throughout the day. People are wanting to know what you're seeing and what you're hearing and what you're doing. You can like us on Facebook. I hope you have seen, as we go out into the community and as you post things on your Facebook page, we try to share that on our Facebook page as well. You can follow us on LinkedIn. Sorry about that, as I try to lose my voice here. Not a good time. Google, Twitter, all of that. We're trying to do that. We also are doing live streaming. Now that is really a trip for both Sylvia and I, because you can't mess up. We mess up every now and then, but you can't mess up because it's live streaming. Like right now, and I'm rambling and I'm going, shut up, Nancy. Anyway, we're live streaming this right now. We're also live stream once a month. We do this month at Alliance HF. And it's a great way to find out what we're doing out in the community, what other organizations are doing out in the community. We post it. We'll tell you when we're going to do it. A few of you, like Gretchen, has sent in some messages. John O'Hanian with 211 sent us a message. But we'd love to get some of your questions from Twitter while we're doing our live feed once a month. We always want to see if y'all can stump us, so, start thinking now. We'll be doing another one in a couple of weeks in April. So we also are one of the few foundations, and I know some of y'all probably hate this part of it, but we are one of the few foundations in the nation that requires a video as part of our application. And it's really innovative because you would be surprised how many times the board looks at those videos, and it makes a difference when they see what you're doing and learn about all of that great and wonderful things that are happening in your communities. So just to continue to move on for the day, I want to introduce to y'all who our playful consultants are. And what we're going to do today, as you can see, the tables are a little bit different than maybe some of the conferences that you walk into. You might not have always seen balls on your tables, right? But you will be using them. They're not just a free takeaway, although you get to take them home. So through the history of our innovation conferences, we started off with kind of kicking off the innovation initiative with a lot of technology. We went to social enterprise. Last year we did the community dialogue. And this year we're creating a space for you to create and be innovative. It's what we've been hearing from a lot of y'all, and I recognize it even in my job and past jobs that I've had. And that is, you sit there and you're so into the day-to-day stuff, and there's people that are coming into your office and your phone is ringing, there's email, and now you've got not only email but Twitter and Facebook and all of these other places that you're trying to keep up with everything that's going on. So when do you actually get that time to step back and say, wow, if I could do anything I wanted, if I had that magic wand, what would I do? What could I do differently? How would I do it differently? Who else could tell me about what I could do differently? I was really surprised at a conference I was at just recently where they were talking about when Southwest Airlines wanted to try and reduce the amount of time it took them to turn around the planes. It lands and it takes off. They wanted that shorter. It was taking them 50 minutes, which is kind of an average, right? It was like when you're on a plane and anyway. In Southwest, they cut it down to 20 minutes. How did they do that? They went to NASCAR, and they watched the pit crews, because they can get a car, change the tires, change the oil, I don't know what else they do to those cars, but they're out. I mean, they jack them up, change everything. There's people running around all over the place, and they're off to the track, because they cannot waste time. It's all about time, right? And Southwest Airlines used that model to reduce the amount of time it takes them to turn around their planes. They went from 50 minutes to 20 minutes. So think about that in terms of your work. Where else could you look? Who else is doing something similar, maybe not the same at all? What is the same about taking a plane off as to changing the tires on a race car, right? But there's different places to look for that. So in trying to create this time, I turned to some key people that I've worked with in the past, and Akshay is very new to me, but to create a space where you get to create, play, collaborate, and be innovative. Akshay Sateesh is with Ziksana Consulting. He has a master's degree in bioengineering and entrepreneurship from the University of Pennsylvania. He's currently working on his master's in leadership studies in USD, and he's a professional innovator. He led product development teams in a medical device unit at DuPont that focused on implants for liver and kidney resections and to treat small tumors of the liver. Now, how many of you providers are doing that? Yeah. You never know what you're going to learn from him, though. And for 10 years, the really fun part about this is for 10 years, he's been a professional improvisation actor. So see, we're going to play and create. He created a troupe that's actually still performing on a weekly basis in Philadelphia. He's a professional facilitator and consultant, uses improv theater as a tool. He works with children and teachers in San Diego to develop life skills using playfulness as a method to teach and learn. I also brought in a woman that I've worked with in the past, Karen Stashauer, who's with Connectics, to help us design this year's conference, to learn from you guys and the feedback that we get. We actually do read your evaluations, so please fill them out when you get them tomorrow. To help us design this conference and create a space where we can be innovative. She works locally with multiple healthcare and nonprofit organizations on issues related to leadership, learning, change, and strategic development. So without further delay, help me welcome Akshay Sateesh. Thank you.
Can you hear me okay? That's sort of getting there. There it is. Good morning, everybody. I want to thank everybody here for being here, and as well as the opportunity to share my passion in life, and we're going to talk a little bit about that. And what that is really using play and playfulness as a catalyst for innovation. And I'll explain all of this coming soon. Before we continue, I wanted to just do a logistical note. For those of you, just check your badges and take a look at the number on your table numbers. I encourage you to sort of try to stick to your table numbers. We crafted your tables very carefully this morning. So try to fill the space. Maybe table number 11, I'm looking back there, could come and join table number 10 perhaps, if you want to. That would be great. So let's get started on what's going to happen today. Here's what we've designed today, Karen and I. I'm going to talk a little bit about the language of play, what is play, and what is innovation. So we can be on the same page with regards to, well, what are we talking about here? Then we're actually going to experience playful innovation. And so pieces of which are already on your table, etc. And we're going to bring that together. And I'm going to facilitate some exercises from here that we're going to enjoy some things together. By the end of today, what our hope is that you would actually experience a fun process that you could potentially take to your organization. Okay, and you can take pieces of it too, to take back to your organization and say, well, how do we innovate? How can we try to think differently about innovation? And or what you're going to also take back, hopefully, is some ideas that you may use for the innovation grant cycle that's starting up, or not. So I think that's what we're going to do. At the very least, is we're going to experience a new way of thinking about how innovation can occur in the organization. So let's start. Again, my name is Akshay. I was born in India, but I grew up in Kuala Lumpur, Malaysia. And I'm going to take you back to my childhood just for a little bit. I went to an international school in Kuala Lumpur. And part of the international school, my graduating class was 113, represented by 56 different countries. And it was extremely diverse. And we were immersed in a culture in Malaysia that was also culturally rich as well. And I remember one week in 8th grade, we were meant to go to Malaysia Week, it was called. And the goal of Malaysia Week for 8th graders was to go into some sort of cultural experience to understand where we live in this country. And so my group of 10 or 15 ended up going to a village just north of Kuala Lumpur. And we stayed with a family. And so a group of us stayed with a family, and there were many families that hosted us. And basically what we were doing was we would go to school with the kids, and then in the evenings we would just be with each other and we would eat in their house, etc., etc. And so that was the immersion for us. In the evenings when we would play with the kids in the playground, we noticed what they were playing. And there's a game in Malaysia called sepak takraw. And sepak takraw is Malay, literally translates to kickball. And if you look at the court on the screen, it looks somewhat like a volleyball court, okay? 3 people on each side, which is different than volleyball, but it's actually the opposite of volleyball. Volleyball, you use your hands. In here, in sepak takraw, you use your feet or legs and or head only. Now, the key to this game is actually that the net, and it's hard to see from here, is actually 5 or 6 feet tall. And so, if you're using your legs and your head, and that's it, well, how do you hit the ball over the net? And so you can see this player in the bottom here using very acrobatic maneuvers. And so in the village, when we were staying there, we were actually witnessing sepak takraw. This picture is not a picture of where I was, because where I was in the kampong there was no net. And so boys were throwing the ball. By the way, the ball was about this big. It's made of bamboo, so it's quite hard. And they were just throwing it and practicing these acrobatic maneuvers and literally doing backflips to practice how to get the ball over this high net. Okay, so I'm not an acrobat by any means, especially not in 8th grade. And so we found it hard, my friends and I found it hard to say, well, how do we play with these kids? The only thing that came to our mind, and we always carry this with us wherever we went, was a hacky sack. And so we knew what a hacky sack was, and we said, oh, okay, well, we'll just play hacky sack on the side while they're playing sepak-takraw. We started to do that, and we all started to look at each other after about 10 minutes. And so, well, this doesn't make any sense. I mean, I want to play your game, and they wanted to play mine. And so we just decided, on the fly, well, let's take the sepak-takraw ball, the bamboo ball, and play hacky sack. Okay, so instead of doing these acrobatic maneuvers, we ended up playing sepak-takraw or hacky sack, whatever we want to call it, sepak-hacky sack or sepak-sack or whatever it is. And so what happened there was we started to play together. And we ended up connecting with boys, specifically boys that would play the sport, that we just wouldn't have connected with if we hadn't been there and we hadn't played hacky sack. We changed the way they were playing their game, at least for that moment. And then something else happened. The girls around the playground who were watching these boys be acrobatic and be really aggressive about their spikes, etc., said, well, now that we're playing sepak-sack, we can play. And so, day by day, one by one, girls started to play with us sepak-sack. Well, okay, so this conference is about innovation. So where's the innovation, Akshay? Well, it's actually quite obvious, and I stated it. It's literally just the collision of two different games that we were playing specifically coming together. And that's it. And it was that simple. But the difference is that what happened was we connected two groups of people together that wouldn't have thought of connecting together at all. Two, we included everybody. There was nobody who wasn't allowed to play, including the girls, because they started to realize that this was a safe enough sport for them to play as opposed to before when sepak-takraw was about spiking the ball. Then there was some courage involved too. We didn't know what the game was going to look like. Is this really going to hurt our feet? Because for us hacky sack players, we all know that it's a soft ball or a soft sack, and that doesn't hurt our feet. Well, a bamboo ball this big playing hacky sack is a different feeling on your feet. But that's okay. We said, we have the courage to try it. Try something new. And both us, as well as the boys and the girls, had that courage. And then finally, in itself, we actually explored new ways to play the game. If you notice, sepak-takraw is played to win points, and the way to do that is to spike the ball. Well, in hacky sack, the way we play is using more finesse. It's like hot potato. You want to keep the ball up. And so new skills, we were exploring new skills together. Well, so I mentioned the word innovation. So let's define it so we're all on the same page. So, at the very basic level, innovation is derived from the Latin word innovatus, which is also the noun form is innovare. So if you break it up, it's in is into, and novus is into the new. So if you just think of innovation as a very basic term in definition, it's renewing or coming into the new. And so in my example just now, I just define it as a new way of looking at a game. So many authors write about innovation, and so many people write about it and talk about it. There are multiple definitions or variations on this theme. But a lot of the things that I've read, at least, have talked about going from ideas to action. So you have an idea, and then you go do it. So, and in my example in sepak-takraw, in the compound, it was sort of the same. We had an idea, and then we tried it. But actually, we acted first. I was playing hacky sack with my friends. They were playing sepak-takraw with theirs. And so what we're going to do today is explore how can we reverse that? What if we had action leading to ideas? What happens then? And so we'll talk about that. A few years ago, my wife and I traveled to South Africa, Southern Africa, and she ended up going to Botswana to do some work in a hospital, and I ended up volunteering at an organization called African Impact. And the organization is a non-profit organization that basically goes in and educates the community that it's in. And it's located in KwaZulu-Natal, which is the northeastern province of South Africa. And KwaZulu-Natal is not known for its beautiful beaches, which it has, or quaint little towns, which it has, but it's actually best known for its HIV rate. It has the highest incidence rate of HIV in the world. 4 out of 5 people, including children, are infected with HIV. The reason I'm telling you this is not to shock you or awe you or bring up awe. It's to give you the mindset in which I walked into the situation with. And I have this information, and I'm a volunteer in this organization. So a lot of the volunteers ended up really going into communities and educating 7th graders and 8th graders about sex education, about how to use contraceptives, and all the sort of preventative things you can do to spread HIV. And there were other pieces of the puzzle as well. Volunteers were also charged with taking some of these parents of these children, who were only about 40 years old or so, to their clinics because they just couldn't get there, and the roads weren't good. So that's what we provided too. Part of my work there was really just going into a school. And if you look at the picture here, it says creche in the background. That's a South African Zulu term for a preschool. And these preschools were filled with children, about 30 or 40 strong. And the age range in the room was between 18 months and up to 5 years. So there are all sorts of kids in the room. Kids who are breastfeeding, kids who are screaming, kids who don't know what's going on, just sitting around, staring at the ceiling, and then kids who are really active and energetic, etc. So you have a myriad of children in the same classroom. Well, as volunteers, we said, we're meant to go in and teach a lesson on 1, 2, 5, or teaching numbers or the alphabet. That was what we were going to do. Okay. So we had this mindset of, I don't know how to connect with these people, with this community. And you're asking me to just come in and teach numbers. Fine. So we walked in, and what we see are exactly what you said, what I told you. Is babies were breastfeeding in their mothers in the classroom, etc. And it was chaotic. One of the teachers said, you know what, let's just forget about this. Let's go out into the playground and just go. I said, okay, great, let's do that. Sounds good. And what we ended up doing was we formed a circle. And I decided, for some reason, to start singing a song. And not just singing a song, because actually these children at their age, they don't understand English. I did not speak Zulu, and they did not speak English. And so instead of just singing the song, I acted it out. And if you look closely, that is me in that picture in the background acting out. Going on a lion hunt. Does anybody know that song? Yeah. So, going on a lion hunt. I'm not afraid. That's the song that I was singing or acting out. And what ended up happening was that all the kids in the circle started to copy. And started to do the lion and going, and whatever I was doing, they started doing their own version of that. And so we all sang the song together. Well, that's fine. We weren't still teaching 1 through 10 for some reason. Well, what happened next was more interesting. Because we had just played a song, played as if we acted it out, this girl in front, who's about 8 years old, decided to start showing us her Zulu dance that she was practicing. And it's a very traditional Zulu dance that she was doing. And if you notice in the background, the other kids are starting to copy her. And they're much younger, but they're imitating it. And in the far right corner, you'll see another volunteer there. Well, what we discovered was, wait a second. The teacher and I looked at each other and said, well, she's doing her Zulu dance. She's doing the dance. Why don't we just have her teach the kids the numbers by just doing the numbers while she's doing the dance? So she can just count the numbers and people will understand what she's trying to do, and the kids may learn some numbers while they're doing the dance. And that was it. We allowed her to take over the lesson because she knew something that could bring everybody together. And so again, our mindset had changed. It was not a volunteer standing in front of the room teaching the children. We said, well, how can we tap into what's already in the community to allow the goals to be achieved? And so from there on, all the other programs started to ask, well, why are we teaching this up front? Why don't we ask, what do they already do? What do they already know? What in their farms can they bring to contraception? What in the work that they do with dance and cultural dance can we bring to not spreading HIV or health? Those are the ideas that started to come together. But what we had done was created the space in which this could emerge. We couldn't have planned it, we just had to see it and do that. So our mindset had changed. We stopped thinking about ourselves and how we could affect them, and we started thinking about us. Well, okay, we're going to test the mindset. Here's what we're going to do. If my clicker please. Well, while that comes up, here's what we're going to do. I'm going to ask you to stand up and turn and face a partner. So do that first. Stand up and turn to face a partner. Just two people. Okay, here's what we're going to do. Here's what we're going to do. We're going to play a game that you may already know. It's called rock, paper, scissors. Who knows this game? Yeah? Okay, a lot of you. Okay, so if someone doesn't know this game, please, we're going to teach them right now. So can I have Karen? Karen, could you come up here for me? Karen, we're going to teach you because we like to play the games together too. So rock, paper, scissors, and you can decide what the rules are for the two of you. Okay, so if you want to do 1, 2, shoot, or 1, 2, 3, shoot, whatever you want, either one, but you just have to be on the same page. So we'll do a reminder for those who don't know what rock, paper, scissors is. We're going to do 1, 2, and shoot. Okay, so 1, 2, shoot. Okay, so here's it. She did a rock, and I did the scissors. So rock wins over scissors. Scissors wins over paper, and paper engulfs the wins over rock. Okay, does that make sense to everybody? Rock, paper, scissors. Okay, the goal is the first person to 3 wins. Okay, so go ahead and play rock, paper, scissors together with your partner. Go ahead. Okay, how's everybody doing? Do we have a winner? Do we have a winner? Okay. We're tied. Okay, so this next game, we're gonna go to the next game. We're gonna stay in the same partners, okay? The same partners. This next game is called Tiger, it'll be on the screen. Tiger, Fireworks, Hello. And I'll show you what that is. So everybody do this for me. The first action is Tiger. Okay, that's Tiger. Then Fireworks is okay, that's fireworks, okay? And then hello is just hello! Okay, so Tiger, fireworks, hello! Okay, this is how you play the game. Those are the three options. So Karen and I are going to demonstrate. This time, you're going to stand back to back, okay? And the same rules apply, 1, 2, 3, or 1, 2, whatever. We're going to do 1, 2, and then turn. Okay, so 1, 2, shoot, and when you're shooting, you're gonna choose one of those three options. The goal here is to match your partner. Okay, the goal is to match your partner. So here we go. Okay, we're gonna demonstrate. 1, 2. Oh, that's pretty good. Okay, now you have to match your partner 3 times. When you're done matching your partner 3 times, turn to me and I'll know you're done. Go ahead. Here we go. So, what's the difference between rock, paper, scissors? Who are you thinking about in rock, paper, scissors? Me. Because I want to win. Okay. I'm thinking about what am I going to do to beat the other person? Okay. And in Tiger, Fireworks, Hello, what's the difference? What are you thinking about? Are you thinking about somebody different? What are you thinking about? 2 people. Us. You're thinking about us. And us actually includes me, by the way. Me in relation to you. Okay, so that's the mindset that I was talking about. So go ahead, give yourselves a round of applause and take a seat. So, what I'm going to ask you, what I'm going to say is, one of the things that exemplifies that mindset about who we're thinking about when we're innovating or we're problem solving, etc., is my experience at DuPont when I was a project leader. I was a project leader for 2 product development teams. One was on a embolic device that was an inclusion. It would block vessels from feeding tumors. Okay, so it would starve the tumor. That's really the product that we were creating. And it was little microspheres that we would inject into the arteries. And then the other project was an ocular bandage for post-cataract and vitrectomy surgery. So we would put a little tiny bit of gel on someone's eye after they had surgery so that it would heal better. Those are the 2 projects I was working on. And both had different teams or different sets of people, chemical engineers, medical device engineers, we had a marketing person, etc. So a myriad of different expertise in the room. And what we had done in our team meetings, we had weekly team meetings. What we have done in our weekly team meetings was basically updates. Well, how are we doing? What are we doing? We all are marching towards filing with the FDA. And so there was some high stakes involved. And what we had also done one day is my wife actually ended up buying me some funky socks. Okay, and I started to wear them to work. And somebody noticed when I was standing on the table fixing the projector, because there was always a projector problem in our room. They said, hey, nice socks, Akshay. I said, thanks. They're bright, and they're bright green, lime green, but that's okay. And he said, well, you know what? I have socks too that I don't usually wear to work because I don't think it's appropriate to wear funky socks at work. And I said, oh, who told you that? Is there a handbook at DuPont that says no funky socks? Or did you just decide that? And he said, I don't know. Well, fast forward a few weeks later, past that conversation, and what ended up happening in every single weekly meeting, almost, was that we would show off our funky socks to each other. And we would talk about that. Where'd you get it from? Where'd you buy that? Why do you like that to go with your outfit? We would talk about that. But it had nothing to do with FDA filing, etc. But what we started to create was a culture in which we were being playful with one another. Okay, so what does this have to do with editing? Well, I'll tell you. One day, one of my team members walked into the office, and she was wearing a little bit of shorter pants, so I noticed her socks. And her socks had parrots on them. And by the way, these aren't the actual socks, because I emailed her and asked her to send me a picture of the socks she sent down. But her socks had parrots on them. And the parrots had different sized parrots. I said, that's kind of cool. Usually you see like this, like the same size parrot. There are different sized parrots on your socks. And she told me, yeah, and I have names for all of my parrots. And I said, wow, you've taken funk to the new level in our group. Fast forward that morning, I walk into my medical device engineer's office, and we're talking about a delivery device for getting the gel onto the eye. And we had a number of different sizes of delivery devices that we could use. And I said, well, what are we going to do? We have all these sizes, what are we going to do? And he said, well, we don't know. Why don't we just give it to the surgeons who are going to be applying it and then let them decide based on ease of use? Because they're the ones going to be using it. I said, great. Sounds like a good idea. Next time we go do some preclinical testing, we'll test the different size delivery devices. Great. That was our decision. We moved on. That afternoon, I went to the chemist's office to talk about the microsphere project, this other project where we include the arteries for the liver cancer, for tumors. And he was explaining to me the structure of the microsphere and the chemical structure, etc., and he had a picture of the sphere on his computer, and we were talking about it. And for some reason, I said, hey, is this the only size you have? And he said, no, I have lots of sizes, because we can just filter the different sizes when I make the batch. Well, I said, okay, well, I don't know what that means. I have no idea what, I just asked the question, because I was thinking about parrots, and I was thinking about delivery devices. And he said, well, wait a second. If we have different size microspheres, maybe we can go after different applications. For example, if you have a smaller microsphere, you can go into the brain to include, issues that are going on there. And you can block, potentially, and open up and block different occlusions that are occurring. And then if you have a bigger one, maybe we can coat it with different proteins so that we can have delivery, drug delivery on it. And so he just started going off on all these different applications. And I said, oh, I'm just doing one project. We're not doing 6. But he ended up filing patents. We ended up claiming those territories for the company entities. So, what are you talking about? We're talking about innovation. Well, where was the innovation? Am I telling you to go start wearing funky socks so that you can figure out how, that leads to this, leads to that, leads to that? No. What I'm saying is, if you can create a playful space where these collisions of these hunches can occur very freely and without judgment, then perhaps you will expose an idea that you already may be staring at. It's so obvious we don't even name it. It's so obvious we just walk by it. Steve Johnson writes in his book, Where Good Ideas Come From, that innovation actually comes from hunches, two people's hunches that are colliding together. And the key is, how do you create that space to allow those hunches to collide? And all three stories I told you so far, we didn't have an idea as to what the innovation was. We just knew what we were bringing to the table, and we shared it. And we allowed the collision to bring new ideas to emerge. For me, the best way to bring those collisions together is through a playful space. And so he really just sums it up, Steve Johnson, in his book. It says, good ideas are the collision of hunches so that they form something bigger than themselves. And so even when Rob was talking about innovation and all these big ideas, well, let's not talk about big ideas. Let's just talk about colliding and seeing what comes. Companies in Silicon Valley, like Google and IDEO Labs especially, use play in their meetings, in their hallways. And we played a couple of games just now, but that's not what they do all day long. They use play in a directed manner. So they funnel it towards brainstorming activity, or some sort of meeting dynamic that's occurring, etc. But they use it. And I'm going to fast backwards by saying one of the greatest discoveries was when Watson and Crick discovered the structure of DNA. And actually, Watson actually ended up saying, the major credit I think Jim and I deserve is just letting the right problem and sticking to it. It's true that by blundering and about, we stumbled on gold, but the fact remains that we were looking for gold. What I want you to focus on is not that they were focused on gold, because I think all of you probably are very focused and know exactly what your passions are, but that they blundered and stumbled. And that play is inherent in blundering and stumbling. And so that is what I want to share with you. And so this next part is going to talk about, well, what are you talking about, Akshay? What is play? The New York Times did a magazine spread in 2008, so it's been a number of years now, called Why Do We Play? It was a Sunday magazine. And they talked about all sorts of things, about what play does to our brain, our bodies, how we interact with other people, etc. Focusing on human play. But who don't you see in this picture? Anybody? Adults! Oh, well, that's no fun, because I want to play. So the New York Times magazine tell me I'm not allowed to because there are only kids on this cover? Well, here's a picture of people, of adults playing. There's a picture of one of the things that I do with workshops, etc. It's hard to find pictures of adults playing unless you take it yourself, by the way. But the opposite of play is not work. And that's something that we want to start thinking about. Well, let's define play, just like I did with innovation. So, if you look up the Merriam-Webster dictionary, just randomly, it says, activity engaged in for enjoyment and recreation, especially for children. Just for children? That's no fun. The National Institute for Play is an organization that was founded by a psychiatrist named Dr. Stuart Brown. And he ended up studying play histories of all sorts of individuals. But what they're focused on is the neuroscience of play. What does play mean to us when, in terms of the brain, and what kind of endorphins are released when we play again? And then what does it do to our body, and what does it do for other parts of the science? And so he wrote a book called Play, and he talks about different properties of play. And so much of the research that's going on in playfulness is very empirical. So a lot of the work is done in animals right now. In humans, it's actually difficult, because if you see pictures of 256 electrodes on somebody's brain, well, how can I run around and play with this thing on my head? So it's been very challenging to collect really data like that, but we're progressing in that direction. But Dr. Stuart Brown talks about properties of play, and I want to mention just a couple of these. Number one, the inherently purposelessness of play. Okay, it's just for fun. But I'm gonna flip that, because there can be purposeful play, and we're going to experience some of that today. There's an inherent, voluntary. It's voluntary. This is a key component, because if you don't want to play, don't play. But if you want to, then you will, and that's a key component to engagement. And when you think about engagement in organizations, there's inherent attraction, there's freedom from time you don't know. This is my favorite, one that I really talk about a lot in my other work, which is the diminished consciousness of self when you're playing. What that means is that we end up not worrying about whether our thoughts or what we did was right, whether it looks silly, whether it's not what is appropriate in right now. We don't think that when we're playing. And so now, how do you start to connect that to innovation? Well, if you had that mindset, and you were free to share your ideas, no matter whether it was good or not so good or silly, but we were allowed to share it, what happens then? And finally, a continuation desire of the body. People who play want to play again. And so what if you had people who innovate want to just innovate again? Or what if you had a place in the workplace that said, oh, well, I don't work, I'm just doing work, but I want to work more? What if you had that mindset in the workplace? So that's what we're talking about here. And so what can play do for innovation? So this is sort of my construct here. Number one, we talked about this in some of the stories, that it can connect people that were not connected before. It is all-inclusive. So it includes everybody. Everybody who volunteers to be a part of it can be in it. So we're not excluding in the story about the girls and the boys playing, but they actually ended up including it. It takes courage to try new things. And when you play, we're sort of shedding ourselves and saying, okay, I'm ready to try something that maybe isn't in my comfort zone right now. And that's okay. That takes courage. But it exists in play. And finally, you actually get to explore new things in a playful space. And those are the key components. There are two things missing on it that will make us, as humans, and especially as adults, feel more comfortable with play. And that's this. There has to be some rules of engagement. And it has to be a willingness, which is probably the voluntary part. And the best example I have of this is my father. Growing up, he was notorious for telling the worst joke ever in the party. Always came up with the most obvious joke, the low-hanging fruit. He was the one who jumped on it and immediately said it. And we'd always say, oh, Ted, that's a poor joke. And we so labeled it a PJ, poor joke. And so we always said, hey, Dad's always known for his PJs. Not pajamas, but poor jokes. But what's interesting about his poor jokes is that we laughed every time. And number two, more interesting, is that he didn't care whether we laughed or not. He was just willing to play. He was just willing to say it because he got enjoyment out of it. And so that mindset of just having that willingness, which takes some courage too, to play or to put yourself out there, is what we ended up seeing in my father. When we're innovating, though, we have to keep in mind, we can't just say, oh, we're all going to come together and boom, ta-da, it's over. Well, there are different personalities in the room. We all work with each other. And so I want to share with you one more construct, and then we're going to see it come alive. And that is something called foresight. And this is developed from a place up in Buffalo, Foresight. And what it talks about is different people's preferences in innovation. And that some people are clarifiers. They come prepared, and they're always asking questions. What do you mean by that? Tell me more. I don't understand. Then there's a person who's really good at generating ideas, just like this. Thinks in the big picture and generates tons of ideas. Developer is a solution person. Oh, I just want to go deep on an idea and decide what's going on, how does this work, etc., etc. And then finally, someone who's an implementer is someone who says, I'm going to take this idea and I'm going to run with it. I want to try it, I want to do it. Well, all those people have different preferences, and you see in your handout, you'll see how to work with those different people. And each one of us has a preference, but each one of us can do all of those, by the way. What is common to have all these work together is we can actually have it done in a playful space. We can have all these people coexist and not be at each other's throats in a playful space. And that's what we're going to experience. And so I'm going to go back to the original thought of, well, how do we connect people? And the reason you're sitting at tables, you may be sitting with people who are not from your organization, because we're hoping that we're trying to connect you to people who you wouldn't have connected with toward this question, which is, given your talent in this room, what could you do together that you wouldn't have been able to do by yourself? It's that simple. Meaning, the collision, right? The collision of you. What can we do together that we couldn't do by ourselves? And that's how we're going to frame the playful space that we're going to create right now in thinking about this question. And so we're going to switch gears toward creating this playful space. And so I'd like to have my wonderful demonstrators come on up here. Give them a round of applause. We have Nancy I'm going to teach you a few games, and then you're going to play it at your tables. And this next section is about playing with each other to just create some connections. And that's it. And so, actually, before, I'm glad you're up here, but we're going to do one other thing before you're up, so you can stay up here. Sorry about that. Is we're going to talk about the rules of our games. Exactly. Because remember, we have to have rules to make it safe in this room, or to make it feel okay. And here's rule number one. We're going to respect each other, physically and mentally. We're going to be aware of each other's spaces, of our surroundings. So when we ask you to do something like this, watch out for somebody's space, because they may be right there. So that's what I mean by saying, be aware of your physical surroundings. And Nancy's showing us exactly what we mean. Your first thought is your best thought, by the way. The first one is your best one. And that's an important one to hold on to. Whatever you say and do is correct. Those two are probably the most important rules to hold on to while you're playing with one another. Here's another one. If you're not comfortable, observe. It's optional to play. Remember? If you don't want to play, don't play. If it's not fun, take a break. And just because this is a large group, I had to put this up here. I'm going to explain the rules of all these games, and they're also going to be up on the screen. Okay, so I can't quite say, repeat necessarily that much. I'm going to go as slow as possible through the instructions so it's clear, but it'll also be on the screen, and we're going to get to play that one. So before we actually play our first game, what we're going to do is you're going to network your table. And what do I mean by that? You're going to take turns on your table in literally one breath, which means that if you are talking over one breath and you take another breath, you've talked too much. So literally one breath, in one breath, you're going to say what your name is, your organization, and your favorite game was growing up. Go do that for just about 1 minute. Go do that.
Right now, just to get pictures.
the size of the tables are a little bit different, so we'll have different motions, so I apologize for this. We'll call you back, and you can still continue playing that game as soon as I tell you what the next one is. Okay, this first game, now that you know people's names, is going to be easier. This first game is called the name game, and here's how you play that game. The name game is you're going to use your first name only. Okay, your first name, so my first name is Akshay, and you're going to think of a word that starts with the first letter of your first name. So, Akshay starts with the letter A, and I'm going to think of a word. And on the screen it says alligator Akshay. It can be alabaster Akshay. It can be aardvark Akshay. I think it's only, obviously, animals and things. But it can be any word, and any word is correct. The first thought is your best thought. And that's what we want you to share. Okay, but that's not it. You're going to, what you're going to do is think of an action, so this requires you to stand up. Think of an action and put it all together. So we're going to demonstrate for you. So here we go. So pretend we're sort of in a circle, but we're in a semicircle so you can see. So I'll start first. Here's what's going to happen. I'm going to do my name and action, and then all of them are going to copy it. And then we're going to move to the next person and continue. So here, we'll do it. Okay, so I'm going to change it. Alabaster Akshay.
Alabaster Akshay.
Naughty Nancy. Cookie Karen. Joyous Chanel. Excellent. Give them a round of applause for coming in that round of applause. Now, the next part of that, so that's an example of what we're going to do. The next part of that is that you're going to pass. Okay, well, let's hold off on that. Let's get you to do your actions. When you get around it, I'll tell you what to do next. Okay, so our demonstrator is going to stay here. And then if you could... Okay, so everybody stand up. Karen, do it. Okay, yeah. Okay, table number 1.
Ladies first.
Okay, so what you're going to do is you're going to do the first part, which is think of a word and a name, and somebody's just going to start, and you're going to do the action, right? So alligator Akshay, and everybody copies it. So, and then you just go around the circle and come back to the last person, and then I'll know you're done. We're going to move to the next level of that game. So go play that name game. We'll wait till the next game. Here we go. So if everybody knows their name, hold on to that same name and same action. And here's what we're going to do next. You're going to pass using that information. So here we're going to demonstrate how we're going to pass. You say your name first, and you don't have to copy this time. You do your name first, and then you do somebody else's. The first person you think of is correct. Okay? So Alabaster Akshay, Joyous Chanel.
Cookie Karen. Nancy. Alabaster Akshay.
Excellent. Give them a round of applause. Yay. Okay. So that's what you're going to do in your groups. Now, so go ahead and get that started, and I'll pull you off of that again. So go ahead and start that game.
Yeah.
pass to somebody that hasn't received it yet? Who here thought that they should pass to somebody who hasn't received it yet? So quite a few people. Okay? I didn't say to do that, but you did it. And so, when we think about what we're doing here, the second bullet point, is what you're doing is this instinct you already have to include others in your circle or in your group. And that's something that play does automatically without instruction. You did that. You included everybody. You just thought about, oh, I should pass to so-and-so because they haven't received it yet. They haven't had a chance because you're trying to be fair. Imagine what that can do when you bring people together to brainstorm or be innovative. And then the other point, the first point is when we actually copy each other, the reason I asked you to do that, is actually you're validating and saying, you're okay. Your idea and name is correct. Okay, no matter what, how silly it looks, it's correct. It's great. So that's what we're doing in that game. Okay, here's another game. This next game is called Bunny. Okay. Here's what's going to happen. You take your bunny ears. Okay, we're going to demonstrate for you. You take your bunny ears like this, and it's a 4-beat rhythm. So you're going to go one at a time. You're going to go bunny, bunny, 2 to yourself, and then bunny, bunny. You're going to pass to somebody. Okay, so that's all we're going to do. So we're going to demonstrate that passing game. Here we go. So bunny, 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 bunny. Oh wait. So we're just doing one at a time. Here we go. That would be crazy. Okay, so bunny, 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 bunny. Good, so that seems pretty easy, right? That seems pretty easy. Okay. So why don't you play that game for about 30 seconds? Bunny, 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 bunny. Just pass around the circle. Go ahead, play bunny, bunny.
Sorry. How do you make yourself bigger? My ADD.
Okay. So that should be pretty easy, okay? That's pretty easy. It's simple enough. Okay, now we're going to add another level to this. Now, here's what's going to happen. The bunny is going to be doing bunny, 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 bunny. But now the 2 people next to them are going to, let's say Janelle is the bunny, the 2 people next to them are going to do something. They're going to face the bunny, and they're going to make big ears and say, Toki, 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 while that person's saying bunny. Okay, so let's do a demonstration here. So you hold on to the bunny, and then the Tokis are on the side, so you can pass to me. Go ahead. Yeah, so now we're part of a circle, so here we go. We're bunny, 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 bunny. Toki, 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 Toki. Toki, 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 Toki. Okay, so you understand even the rest of the colors. Oh, wait a minute. It's not so easy. So here's what we're going to do. The instructions are on there. The 2 people on the side are going to face the bunny and say Toki, Toki, while the person's going bunny, 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 or being with them on both. So go ahead and play bunny, bunny. With that element in there. Okay, so go ahead. okay, we're going to change the game. Meaning it's the same game you're going to play, except now we're going to play competitively. Oh, okay. So now what happens is, if you mess up, so you don't do, if you're standing there and the bunny, you're like, yeah, that's you, you go ahead, yeah, you're good. But you're meant to be doing the toki, but you're out. You don't get Oh, okay. And so also, if you for some reason go, toki, bunny, oh, no. That's not right either, because you're going to say bunny, right? And the tokis are in you. Okay, so multiple ways to get out. Now play competitively and see what happens. Go ahead. In that game, in competitive mode, what was different? Did you notice the difference in yourself or in other people? You chose not to compete. Okay, great. So you made an executive decision. You changed your body language. Did anybody notice that they're focusing more or they're trying harder all of a sudden? Okay, that's usually what happens when we put competition in a game. Now I want to be there. Remember rock, paper, scissors? We want to win. Well, what are we winning? Well, nothing. Just glory and pride. And the ability to keep playing. That's what you're holding on to in that. To stay in the game is what you ended up physically and mentally thinking about without being able to enunciate it, perhaps. And actually, some people, when people, I don't know if anybody experienced this, but when somebody makes an error, did anybody go, oh, you do that? But when competition comes into a game, we actually end up focusing on someone's errors, as opposed to their silly, oh, it's okay, they're allowed to do that, it's okay. And this group was an exemplary, they said, we're not going to compete, it's okay. So great. The next game is called Speedball. You all have little balls on the table. Just grab one of them. Just grab one of them per group. And if you didn't notice, they do light up, so that's kind of fun. So here's what's going to happen in Speedball. Speedball is in your tables. You're going to stand in a circle, so you may want to stand away from the table, whatever you want. But here's what's going to happen. You're going to pass the ball to somebody, okay? You're going to pass the ball to somebody, and then you're going to pass, the next person is going to pass to somebody who hasn't received it yet. You're going to establish a pattern, and it's going to come back to the original person. Does that make sense? Okay? So go ahead and do that. Just establish the pattern, and then it's going to come back to the original person, and then stop right there.
Anybody's looking after the ground. Yeah.
Okay. And you may want to do the pattern one more time just to remind yourself what the pattern is. Do the pattern again. Remember the pattern by doing it again. Okay, so now that you have a pattern, if you have a pattern, now, do the exact same pattern, except now time yourself. So go ahead, you're going to time yourself and do the exact same pattern, time yourself.
What are we supposed to be doing?
We're going to have a
really good when you rotate on a live stream. Makes you so much better. It's a little more produced.
Here we go. Here's what's going to happen. I'm going to ask you now that you've timed yourself, I want you to find ways to cut that time in half. But you still establish the same pattern. You still have to, right? Does that make sense? Find ways to cut that time in half. Go.
Don't catch it. So you get to the bird, you get to the cat. Yeah, right. Let me get these guys behind you.
Okay, here we go. We're going to do one more version of speedball. Okay, one more version of speedball. Now that you've cut the time in half, you've got some way to do it. Now, you're going to find a way to do it in under 1 second. Find a way to do it in under 1 second. Go.
Wait, do you want to touch my set?
Under 1 second.
So, here's what's happening. Notice that the goal of the game changes. In the original sense, the goal was just to establish a pattern and repeat the pattern. Okay? But then when I started to say, oh, cut the time in half, who here stayed in the circle? A lot of you stayed in the circle? Yeah? Okay. Why'd you do that? You got closer? You stayed in the circle and you got closer? Okay, great. Okay, wonderful. Because the end matches the beginning. Okay, maybe. But what we're doing actually is when you stay in the circle, because I said in the beginning, stay in the circle, I gave you a pattern of how to work together. And now you probably held on to that versus standing in a line versus figuring out that actually the solution to this, should I give it away, is standing with a ramp and just dropping the ball while it touches all your hands. Okay, anyway. Yeah, well, yeah, that's true. So the goal is to touch the ball and get back to the first person somehow. The person can run. So the key here, the message here, is that we held on to, you already held on to our pattern of, let's stand in a circle and try and do that. And maybe a few of you broke that pattern, okay? And what we hold on to is something that we're comfortable doing, which is standing in a circle or figuring out this pattern that we just established, and we're going to still do that. We're still playing. Come on, Akshay, I mean, we're doing it. Yeah. But think of when you hold on to your own patterns. I'm not saying you shouldn't, but think about what it may do to how to approach a new solution to what you're trying to achieve. So we establish a pattern, and then we actually don't end up breaking it or thinking of how we can get from point A to point B. And that in itself can be an innovation. Let's not stand in a circle, let's stand in a line. That's an innovation. That's a new way of thinking of how we're going to do this. Okay, last game before we switch to the next section. I need my demonstrators for this. Come on up. This game is called Human Machines. And this is going back to the concept that I talked about with regards to, instead of going from ideas to action, let's see if we can go from action to ideas and see what happens there. Can we create an idea or see an idea that we never saw before by putting us together? And this game is going to teach that. So, Human Machines is fairly simple. Here's what's going to happen. One person is going to stand up here and is going to do a simple motion. Okay, make it simple, okay, because you're going to be doing this for like 2 or 3 minutes. So, jumping jacks may not be a good idea. Okay, so, simple motion, and you're going to have sound, okay? So, blip, 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 whatever it is correct, your first sound is correct. Now, the next person is going to come in and going to fill my space somehow with another motion and another sound. So, here we go. Blip, 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 and then continue, blip, blip, blip. Blip, 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 blip. Perfect. Give them a round of applause. Thank you. Fantastic. Now the next phase of that is you're going to have 4 people if you're a group of 8. So if you're a group of 6 or whatever, split yourselves in half if you can. And so the half the people are going to create this human machine, just like we did, right? The first person's going to start. You have no idea what's happening. Just create the machine, okay? And then the other half of the people, whether it's 4 or not, are going to name the machine. They're going to name it. Is it a washing machine? Is it a car engine? It has to be a real machine, so trying to make it like it's a happy machine. Let's make it a real machine. A real machine. And then I'm going to ask you as well, what else does this machine do? So, for example, if it's a washing machine, and somebody over here is going, it's a washing machine that pours coffee. Excellent! That's it. So that's what you're going to do. You're going to go 3 or 4 people, create the machine, name the machine, what else does it do, then switch and do that process again. So go ahead and play that game. New something else. Yeah, name what was your machine? A self-cleaning prize machine? So it was handing out prizes, but it was also cleaning itself? Excellent. What else was, what else? One more thought. Yes, one in the back. Go ahead.
We had a forklift
That did what?
that went in reverse.
A forklift that went backwards. Excellent. So I don't know how that works, but it doesn't matter. It's great. So yes, sir. Go ahead.
We had an elevator that rolled you and pushed you out.
We had an elevator that did what first?
It did the lint roll for you on your suit and then pushed you out.
It did the lint roll on the suit and then pushed you out when you needed to get to where you were going. Excellent. Excellent. If only we had that for real. Whenever we needed to. I don't know where I'm going in force floor. Well, don't worry, the elevator will take care of that. Great. What you just experienced was two things, at least. The bottom one, which I'm going backwards always today, is innovation. Those new ideas that we just shared, just 3 examples. You did not know what you were going to create. You just stood up there and did something silly and had no clue what was going to happen. But number one, there are other people involved, which helps, by the way. And you came up with an idea because you saw it. You had no clue you were going to create an elevator like a lint roll, or a forklift that went backwards, or this self-cleaning prize. No idea. This all happened just now, just here. And so you can go from action to idea, depending on how you frame it and how you structure it. And that's what you just did. And the most important part, as I said before, other people. Every component of the machine that you just created helped you see what it was. That goes back to that inclusiveness of having everybody involved can make you see it in a different way. Because every one of us has a different interpretation or has a different piece to add to the puzzle. That's what that game is all about. So give yourselves a round of applause one more time. And so in summary, what we just did just now was really just creating a safe environment, at least amongst your tables, if not in the room, to play. Just to be with one another, to connect, to include, to have the courage, by the way, you all have some courage right now, to be okay, I'm comfortable playing these games. Okay? Maybe you weren't in the beginning, but now you may be more. And the courage has risen. And then now, you've also explored some new ideas, the new machines you did. And so those are the things that we're going to hold on to as we move into the next phase of innovating together. And now we're going to make it a little more purposeful in play, using play to innovate on our tables. And so this next section is Act 2. We're going to actually ideate, create, generate ideas together, okay, through the collision of who you have on your tables. And so I'm going to walk you through that and explain it. But remember, going back to our original page of rules of engagement. First idea is your best idea. Whatever you say is correct. I want you to hold on to those, as well as obviously your respect for others and allowing people to share. Your first thought is your best thought. I'm going to add one more rule. And this is cardinal. A cardinal rule in improvisation theater. And I haven't talked about that, but I'm just going to mention it. And that is yes and versus yes but. When somebody offers something, we say yes and. Yes to honor it and say, yep, I accept it. I don't necessarily agree with it, but I accept it. And there's a difference between those two terms. And then the and part of yes and is building on it. In fact, you just did that in human machines. When you went up there and I was going like this, for example, Karen, whoever else came up next, Nancy, didn't say, no, that's not a good move. I don't like that move. That's terrible. They didn't say that. And you didn't either. You just said yes. I accept your move. Whatever you're doing is correct. I'm going to now and it. I'm just going to build on it. Find my spot in the puzzle and build on it. So you actually did this already, but I want you to hold on to this when we move into this next section. On your tables, in the middle of your tables, you should see a roll of chart paper or flip paper. I would ask you to maybe make some room on your table and open that up. You should have about 5 pages. We're not, we're going to start with 1 and see how it goes. But we're going to use these pages to help us collect our ideation process for the next section. Okay, so grab that. You should have markers on your tables as well, so you'll see those somewhere there too. So grab a marker, and I'm going to go through this next activity, and you're going to play the activity together. Here's what it is. It's a simulation, and here's the simulation. If you look on the screen, you see 2 columns, one on the left and one on the right. And what I'm going to ask you to do is, just like in human machines, I'm going to ask you to split your table into half, okay? And you're going to have 2 contentions, Group A and Group B. And Group A is going to choose something, an item from the left-hand column, the green column, or whatever the color looks like to you. And then the Group B is going to choose something from the right-hand column, okay? So split the group. One choose from the left, 1 item, and the other group choose 1 item from the right. And the first 2 minutes, which I'm going to give you 1 minute each, you're just going to say what this thing, for example, what is Michael Jordan known for? Okay? So that's what you're going to explain to the other group. And then the other group, Group B, what is Whole Foods known for? Okay, you're going to explain that to Group A. So that's what you're going to do for 2 minutes. So first choose an item on the list, and then hold on to that and just explain to the other group what that item you chose is known for. 2 minutes, go do that.
They offer great quality, but they're not the one.
Yeah, what is it?
Okay. So you should share some, at least a few things of what Apple is known for, or what Michael Jordan is known for, etc. Okay. Now, this next process is you're going to use that flip chart paper, and you're going to capture 5 ideas. You're going to still hold on to those 2 choices. You're going to choose 5 ideas that these 2 choices that you made, for example, what can Lady Gaga and Whole Foods do together? What could they create together? Together, come up with 5 ideas in 5 minutes that answers this question. What might these 2 entities do together that they wouldn't be able to do before? So you're going to collide, make them collide, and take 5 ideas in 5 minutes. Capture that on the chart paper. Capture that on the chart paper.
You would face
Right, so Lady Gaga, together
future
So we have an iPad, iPhone, wireless pad, slash HD, AC, and then we have let's run with that one.
to make it physical. That's why those kinds of opportunities are not going to have or be able to afford on the
Right,
page
exactly.
So, talk about that.
Two more minutes. So don't hold on to the yes and. Whatever someone says is correct, capture that. Okay, even one more idea. Just get, if you don't have 5, just choose one more idea and then wrap it up. Okay, so let's get out of your attention. So, just a couple of samples. I just want to hear what people think of this. I didn't walk around and I thought this is pretty cool. So, anybody want to share one of their ideas that they thought was cool? Yeah, go ahead.
Yeah, I find Apple and TV together.
Oprah Winfrey and Apple. The I.O. network. Excellent. The I.O. network. Got it. Excellent. So we can talk about what that does, but that's fantastic. Go ahead. And okay, Lady Gaga at Whole Foods wearing an organic free-range chicken breast. Excellent. Excellent. Nobody thought about that until it was down, by the way. Okay, let's just do one more example, maybe from this side of the room. Yeah, go ahead. Awesome. So Michael Jordan at Whole Foods, and shopping could be more fun because he can just take the grocery bag and shoot it into your shopping cart. Okay, or even the items we talked about. The items can be shot into. Oh, awesome. Great idea. Give yourself a little. Oh, go ahead. One more. Go ahead. Go ahead. Oprah and Apple.
Yeah, they can FaceTime with your kids in Africa over the O phone with the kids and taking like.
Oh, the O phone using FaceTime, etc. is fantastic. Excellent. To connect different people, so we're also connecting people. Give yourselves a round of applause for playing that. Now, the reason I'm able to play that game is for it's coming up. But think of it as well as when you were experiencing each other, when you were simulating this ideation process, what was happening? Did you notice what your preference was? Are you good at generating ideas really quickly? Or are you thinking and saying, I don't know what the big picture is, or I don't really understand that. Tell me more. What do you mean by that? Are you asking, are you to clarify, or are you looking for solutions? So sometimes that comes up in this type of process. And it's okay, but we just wanted you to be aware that it exists. That notice the preference that you have, and that how you can also work with others. That's why the rules are in place to say just yes to it to make it easy, but as you move forward, that those roles may change. Okay, take a new sheet of paper, blank sheet of paper, okay? You can put that, you can fold it and put it down on the ground or on the side. Take a new sheet of paper, and this next game is called stats, or statistics, okay? And here's what I want you to do. First set it up, which is first write on the chart paper 2 columns. So make 2 columns. On the top of one, you're going to write, I am good at, the bold print on the left. I am good at, and on the right, you're going to write, I wish that in San Diego, ... So both one column is, I am good at, ... And on the right, you're going to say, I wish that in San Diego, ... So first create that chart, and then I'll tell you what to do next. So take just about 30 seconds to set up that chart. Whoever described it in your group. Okay, so once you've done that, here's what you're going to do. 2 columns. You're going to think for a minute or less than that individually, just for yourself. What would you put into those 2 columns? We're just going to ask you to put one idea in each of the columns. For example, I'm good at cooking. Okay, that's my thing. I'm going to write it down. And I wish that in San Diego there were free immunizations for children. Just whatever comes to mind is what you're going to capture. Then you're going to pass the pen to the next person on your circle, okay, in your table, and they're going to generate that list. So generate that list for about 5 to 8 minutes. I'm going to walk around and see how you're doing. Okay, go ahead. And the instructions should be up here if there are any questions.
Whoever's ready to write.
No, you're going to create your own list. These are just examples, so don't use the list that's on the chart. You're going to create your own. Each person's going to do your own list of your own contribution. And you're going to have 1, 2, 3, 4, 5, 6, 7 different things on each one that's yours. Does that make sense?
So there's 7 of us, 7 on each side.
You won't even believe it. That's pretty
Okay, I'm good at singing.
He did exercise.
Oh.
put like kids' faces in this thing. It's like a little picture. I just couldn't figure out.
Video airport would be nice. Places that we have.
So it's red.
Black.
Black.
Oh, I didn't see that. Okay.
Running meetings. More affordable housing.
Oh yeah, we do. Like that.
So I can see you guys, you all are generating it very quickly. So instead of 1 or 2 more minutes, you have to finish. Make sure everybody is able to contribute one idea to each of those columns. 1 or 2 more minutes. Oh, if you want to do more than one,
Okay, well, I figured you guys had
No, we need help too.
Good one.
Yeah, these targets are low.
Okay, so trying to wrap up, maybe if you haven't had everybody can contribute, make sure you do. And now you may know where we're going to go with this, that we created this list. So I would take a fresh sheet of paper, keep that paper on the table because you're going to need it. But you're going to take another piece of paper and put it right next to it. And here's what I'm going to ask you to do. Take a look at your list. There are 2 lists that you should have. There's a lot of lists. I can see a lot of ideas, which is fantastic. Now, for 3 minutes, a very quick rapid-fire activity is, as a whole group, as an entire group, you're going to choose one item from each column, perhaps at random, or like you chose it like the last time, Lady Gaga and Apple. You're going to choose one from each item and capture 3 to 5 ideas on a separate chart of paper. Watch out because I'm going to make you do 3 of those on that blank sheet of paper. So you're going to take one idea from each, generate 3 ideas, one item, and then we're going to repeat it. So first start with the first one. Take 2 minutes to do that. So take one idea from each, create what would these 2 ideas do together? What would they do together if you combine them together? Think of 3 or 5 ideas from each of those now. So do one first, 1 second, and then I'll call you back and do another.
We voted. So I think we pick one item.
Yeah.
That's not in it. We're not doing that. That's off the table. That's off the table. Great. So pick one.
First do 1 pair. Just do 1 pair, and you're going to have 3 ideas for that 1 pair. What 3 ideas could that 1 pairing do? For example, organizing events, something. So 1 pair, come up with 3 ideas for that 1 pair.
So then the system say, okay, over here what we're going to talk about. You know, how they are here, how they here,
Access to pressure again.
She'd be willing to take like a 10-minute picture on the stage from them, and we'll tell them we'll post them on social. They can get the pictures in. So these 2 are very connected. Let's go. We've got 3 minutes. Great. Okay, so let's talk about things. Oh, they can do together.
Yeah, same thing we did with McCray.
Yeah.
Zuckerberg.
That everything is doing right? One of the more important ones would be like,
How does this link none of those ideas?
Where do we have these solutions? Same solutions coming up with new ideas and how to
and my suggestion is that we talk about storytelling, one thing, writing or listening. Those are all actions that will help us with solutions.
Sorry, I just had this idea of education.
I mean, yeah, you need to, I feel like we need to give what we're going to give. I think one of the more, like,
And then we go to the next one.
I'll tell you.
I mean, I guess
Solutions that can
maybe we're focusing on.
everyone will never find ideas.
I immediately our brains get locked when we say same solution because that's we're outside of our creative space. You know what I'm saying? We're in a but that's not I'm saying like we're locked now because we're doing something that's not like same solutions now. That's no we're saying singing in between all we can talk about dancing and all you know what I'm saying?
Let me be brief. Just say using
Okay, that's rapid fire, so you said at least an idea or two.
Okay, let's do that.
If you choose one more time, you do that pair, and then do another pair. Do another pair that you haven't done. Draw a line to another pair, just for practice.
Thinking, is that what we're thinking, or that was just one of Blair's ideas?
number one. That would take a lot of
Yes, and I was thinking of on the other side of like on the participant side of some road
but someone didn't know
way for
because I want to get the show on with the school with it and I don't know I just trying to think they're a couple $100
While we were talking about this now, we abandoned this one.
that's I agree. I don't know. I thought I couldn't really think better.
All right.
Room 5, unanimous decision.
All right, so we need some ideas about
because unanimous board decision on room 5. Can you make it work? Of course we can. We'll write it down. So like social media
understand like I don't know, but like what's the pathway to like I think I'm talking about suicide prevention projects. Vision that there is a life beyond
individual responsibility is great. Yeah, right. I'm always a little suspect on how people present, right? You can kind of, well, you know, and there's this one, and it's called atypical, and you know, and then there's room. Right? It's all how you present it. I too. We came in with some other songs. The code and carry code. Atypical, like fucking really.
Spend about one more minute on whatever idea you're on. You have probably two. I see those are two separate lists. Great. One more minute.
Talk about this.
So, have you guys ever tried live streaming? Yeah, I got it. We just, one or the other. I don't know if it's the one we got into.
Yeah. So we were
Yeah, well then you get that, you get to buy the bandwidth. Right, because you can do it free, but then they shovel this content.
That's already, that already exists.
Where you go.
They'll shovel your content and stuff. Like, cool, they'll let you do it, but this is what you got to do. More bandwidth to get. Well, it's almost kind of like you want to buy ad-free time.
Right? We're going to move forward ahead with what we're going to do next with it. So even if you have just one idea that you fleshed out a little bit, that's great, that's okay. If you have two, that's fantastic, no problem. Here's what I'm going to ask you to do with those ideas. Here we go.
I use their outlets that discount codes on
Okay, so here's what's going to happen. Now what you're going to do is you're going to choose one of those ideas. For those of you who have two ideas or even three up there, great. If you just have the one, then I would just choose that. But what you're going to do is if you have multiple, here's what I'm going to ask you to choose in the frame of. And there's a reason why I'm going to put these up. These three items here, it says, the potential for the most impact in San Diego, or most playful and fun idea, or the most innovative idea. Or, actually, no, that's not the right one. It should be the number impact for the greatest number of people in San Diego. Okay, so here's what I'm going to do. I'm going to ask you to just choose one idea that you just generated. You generated some ideas of how to pair these. Choose the one in about 1 minute or 2 minutes tops. Choose one, and then I'm going to tell you what to do with it next. So go ahead, just for 30 seconds or so, take a look at the categories.
Reach.
I don't know how many people watch these things. They look nice. Right. I almost think that we get I like the cachet of we're streaming live. Right, because everybody's heard about it, not a lot of people do it, and most people do it for the but the recorded stuff, we get a lot of views. We had one that had like 176 views, I think, on the bullshit came that live. We use up on the website. But so yeah, 176 people, how many was it? They couldn't make it to the conference, but they made it to the conference, right? So what, man, if me or Nancy that run the fucking innovation and healthcare communication,
okay. So choose one. I know it's hard to make a choice sometimes. Choose one. Hold on to your choice. You will be good. It's the correct choice, whatever you make. Now, in the ideation process, it's also in your handouts when you take the program, is you go from divergent, which you started to do just now. You sort of brought this process in. We're creating ideas that we would have never thought of before. That's the divergent process. And we're going to continue in that realm. But now you've chosen your idea of how you're going to come together. And for the next 10 minutes or so, if not 15, we're going to continue that. On your tables, you will now find a yellow sheet of paper. It's camouflaged in there somewhere on the table. Is a yellow piece of paper, and what that is an infomercial that you're going to generate. And so as a group, it's like Mad Libs. Okay, ladies and gentlemen, do you have a problem with blank? And so you're going to take your idea that you just chose and fill this Mad Libs sheet out. And by the way, there are 3 pages of Mad Libs. And so this is going to be used later on, by the way, when we pitch our ideas to each other, and later on when we're going to pitch in front of people. So this is the first thing that you need to do. There's a couple other things, so bear with me. Don't forget, yes, and you're going to develop a human machine. Remember the human machine game? So you can develop a human machine to represent one aspect of your idea. Okay, don't worry about what it is yet. Fill this out first, and then it may come to you. What could we create a human machine to represent? If it's people waiting in line in the emergency room, and we are now serving coffee, well, it could be the coffee maker as a human machine. Okay, it's just a playful way to represent one aspect of that idea. And finally, you're going to create a team name and an action. So, you know, we're the superstars of San Diego, and you're going to freeze, or whatever it is. Those 3 things you're going to spend 10 to 15 minutes doing right now. On that one idea. Go for it.
All right, so first we have the question ever make you unhelpful.
Yeah, like the inability to handle your mental health, maybe pick an anger, like whatever, make you ineffective, unhealthy
It gives you a framework.
So, do you wish that, you knew exactly what to do? It needs to be more personal. It needs to be, do you wish more like you knew exactly what to do when you were angry and you know what
Yeah, I just have the pop of the tables off when I
It's just one way. And here's our big idea. We've got the answer to you, that's why we're introducing you. We need a name. Mental health because we shorten this so I can testimonies of this I'm going to break them down.
I was looking here, right?
That's why we're introducing.
When do you see it?
That's all the
we would be done, although
that's the new frame of reference.
So why don't we just go to this regards? Let's show some of the ways that
The benefit is then reassert advantages or provide you the answer where to turn.
My concern is if you let go of launch, people aren't going to be
yeah, that's right. The idea is show features, and then that may blank, let everybody know where it's already launching. You get your one, two, that's right.
There's nothing
confidential history, expert,
Okay, so when we do that,
So if you want to pass it,
so after he's done, you're going
we can do another. Key questions. Because we have to decide who's going to help these people in the room that are going to be helping direct consumers. So you have problems with managing breakout.
Managing your emotion. You're managing your managing your emotions. Yeah, here, does anger ever make you feel out of control? Does sadness, yeah, there you go.
Do you have thoughts of
Yeah, I mean, you're just saying be playful with it. You don't know where to.
I'm dramatic for a while. Like, who said that? Then do these things out of
ever made you feel insane?
Yeah, for everybody. And not just when there's a crisis.
Do you wish that you didn't have to take medication, seek help, just to treat something, just when it's behind the scenes?
I'm going to unprivatize that and then he's going to be able to pull it out.
We're talking about like overall mental health for everybody. And do you wish that you had, like really what we're talking about is an easy prescription. You wish that an easy to meet your
When I talk about it translating, like, do you feel like not being able to manage mental health has actually caused physical
There's another question.
anxiety. Have you ever thought about your
So what we've got to do, that's why we're introducing your personalized fitness, mental health, fitness, and social
give it a day
for the day, just like
There you go.
Routine.
Trainer.
He's got that YouTube page, Upset of their trail. Puts it like some feature thing. It'll show up on both. When he goes,
I would
I'm going to cue him more.
do that as well and get on to a computer machine to demonstrate some aspect of your idea. Okay? We want to get as much playfulness as possible. And then don't forget, you need a team name and an action as well to use in the next phase. You have about 5 more minutes, so I want you to get up and get rolling. 5 more minutes.
I just came here to now I know. I make peanut butter and going family.
And then we're having the next advantage. You'll have
Now we make a name figure out things. And it could be like a mental green color. Big word, but actually, they don't like it. I'm like logo design.
Changing the world.
How about that? I drew a robot.
Created an app.
What about your name?
It makes you actually want to know. And
If you act down, you're one.
I have to keep remembering to switch titles up so it keeps it interesting and cool, right? I change the shots up. There you go.
For being the 2013 Innovation
Okay, I'm going to call it 2-minute warning. 2-minute warning meeting. Should have some, most of your amendments. It's not necessarily move on to your meeting machine. Create that machine to represent something. And then make sure you have a team name and action before we move on. 2 minutes to do that.
yeah, very excited.
I think we were doing it when you guys just say, you know,
made a great we did cheer.
Yeah.
There you go.
Wait, say it again. The human machine we did
You guys have to come up. We need a team name and a cheer. You guys come up with a team name and a cheer.
The internet makes a world of difference. We're shooting out 30 frames per second. That's like TV. Diagnostics.
How many people are watching?
It fluctuates. I didn't know this.
Right. I'm taking it.
Yeah, you know, I'm not taking things I like. People who can't and there's a cachet. One of our last we had like 176 post-event reviews, and they were responsible for one, but it was just not fun. It's just that, so that's what we need to do this event. And try to get this message out. Just so much more people.
Because of our time constraints, we're going to take what you have and hold on to it, be proud and hold it. So, what we're going to do, we have to be great. I at least would like to Okay, so what we're going to do is whatever you have is fantastic. Okay, you have some part of the manual written out, that's fine. The human machine, as you saw, you can actually just create it on the fly and then call it something that is part of your pitch. Okay, so I would recommend doing that here because it's just going to be fun. And then if you have a team name, you really just come up with a team name because this next part of the process is we're going to actually pitch to people in this room. And here, I'll explain how that's going to happen. But before we continue, this part of the process that we just did was still part of diversion. And we are diverging and developing the idea a little further. We're taking one idea and just yes-anding it. And now we're going to converge a little bit, which we're going to filter out some of the ideas that we have. And this is just to understand the process. At the end of this session, we're actually going to collect everybody's Mad Libs page, the infomercial page. So all of your ideas are going to have value. We're going to collect those. So I would also recommend putting your names, everybody that's involved in the infomercial, write your full names on that page because we're going to collect those. The other thing we're going to collect is that original chart paper with those ideas I am good at and I wish that in San Diego. We're going to collect that chart paper. Okay, so Nancy and Karen, we're going to walk around, collect both of those. Not just yet. You're going to hold on to your yellow pages because you're going to use that in your pitch. But towards the end, by lunchtime, we're going to collect some of those. Okay. So make sure your names are written on those orange or the yellow paper, the golden ones. So in the convergence process, we're going to vote in a voting situation for the ideas that we like. Okay? And after lunch, we're going to actually see some of those pitches as samples. Okay? So that's the rest of the program. So this next section is you're gonna pitch to the tables. I'll tell you who the tables are. And then we're gonna have lunch. And then we're gonna come back and we're gonna sample some of those pitches and see that. So this is your opportunity to practice your pitch. with the Mad Libs, with the human machines, with anything else that you came up with or are going to come up with on the fly. So here's the process, okay? Here's what's going to happen. These three tables are going to work together. So you can sort of move off or something. What you're going to do is you're going to pitch your idea to one another. I'll explain that process. I'm just going to split the groups up. So these two tables and that table over there are going to work together. Okay? Got it? So these two and that table there. This is an easy one. This is a straight shot. So these three tables here, does that make sense, are together. Got it? We're going to do a twosome right there. These two tables are going to go. And then this is the final threesome all the way at the back. Does that make sense? So you know what your table groups are. Each table is going to pitch to the other two groups. But you can't just say, okay, hey, we're going to pitch. You got to introduce yourselves in some way with your team name, maybe in action. Okay, that's one thing you want to do. Then each group is going to spend 3 minutes, really quick, pitch your infomercial. If you have a human machine, do that, or anything else you can come up with. Okay? And the process is when one group is going, the other groups are just listening. Okay? There's no feedback except for the round of applause. So first, give yourself a round of applause right now. And so when everybody finishes pitches, just give them a round of applause. Maybe even give them back their team name in action, superstars, or whatever it is. So that's the process. So, and I'm going to tell you what to do after you all pitch. So spend 3 minutes each pitching, and I'm going to interject and tell you what to do with that. Find your table groups and start to pitching to each other. 3 minutes each. You want to get up.
Part of pitching is showing them We have this group here, I think.
This one? We're pitching video. Oh, hello.
Why don't we go back here so we can all... What else do we need?
Playing. Took him a little while to work. He realized that I wasn't That's why we're introducing your own personal mental health fitness program. available through your smartphone, tablet, or online, and it will help all San Diegans achieve their full potential by effectively managing mental health before they reach crisis. That's right, this idea is so incredible. Here are just a few features of MintFit. MintFit is so good, it's customizable to your own needs. It's accessible, free, and completely confidential. We have experts with this and mental health professionals available for a variety of if you don't have the here's one of our
keep them all horizontal so we can use like the color photos and stuff.
You will get one puff. Right, you go. Wait, no, do it again.
That's right. I was so good. We're not for the next 3 hours. We're waiting, everybody. Not only getting some tired, now we're going to get it. That's right. I can't believe it.
Well, have we got the answer for you? That's right, this idea is so impressive. Here, this is that entertainment is so good. Number 1, it's free. 2, it's easy.
We have an extra break. far, so good.
Any issues, or
Ladies and
good or
gentlemen,
bad?
go seek help.
God training me on the
Well, we have the solution. If you're asked those questions over and over, ad nauseum, we know what it feels
That's great.
So far, this is a data integration platform. So wherever you go, you can actually get help, not paper. My team is about to demonstrate how this might look in real life. So when you're sick and tired of going to the doctor's office, we've done this campaign that we can validate we have this I think is so good. Our system contains all the known data about your life so far. And once it's fully in operation, it automatically forwards care with all your providers, no matter what specialty and no matter what sector of health we're talking about. Your mental health, but don't just take my word for it. What we're very satisfied with so far so good. Christina has moved 4 states in the last 6 months, only to find that no one knows who she is, what she needs, how to get the things done. But so far so good, she's cut down on paperwork. It's no longer spinning in circles or talking to endless awkward staff and providers in order to get this meeting. So, this is so far so good.
There's another thing we're supposed to do. We're the last group, so he's coming back. We can do our
It gets stuttered. Yeah.
I'll get it.
I don't think anyone's tweeting.
Most of you have finished pitching. I see a group in the back and a group right here that have finished pitching. If I could get your attention, this group already is doing what they're meant to be doing here. So here's what's going to happen. The 2 groups in the back, what I'm going to ask you to do is, you're going to do a voting round, okay? And what that means is, you're going to grab a blank sheet of chart paper. You're going to write your title of your innovation. On one sheet of paper, you should have 3 titles, okay? And each individual in those 2 groups are going to vote for one idea by just putting a hash mark, okay? For one of those ideas. It can't be your own idea. Okay, so you have to vote for one of the other 2 ideas that you've heard. And then when you get to that, when you count the number of the ballot, star the top 2 ideas. Okay, star the top 2 ideas. I'll tell you what to do next.
What was your? I'm gonna make it. G to G. G to G. The word 2 T R. Made a grace. G to G. Or G squared. We're gonna swap votes with them. Yeah. You spread in my bag. So each person gets 1 vote.
Bill doesn't like the light color text on the T website for Brandeis, Harvard's partner. So he wants to talk about it. I'm like, okay, we can talk tomorrow. He goes, sorry, maybe it's an age-related thing, but no, I'm going to hear they have old customers. They have old prospects. I don't know if anybody says I can't reach yet. We need to address that.
We can't take the sludge approach.
Huh?
We can't take that sludgy learning approach.
No.
You change that back up soon.
Yeah. And the snippets are great. It's really fun. Here. This is my sound box. We have an 8 o'clock meeting tomorrow morning. So, you know, if we have people that calendar, I guess it's just mine too.
We've got some dissatisfied losers. I mean,
don't forget everybody vote.
Yeah, and I'm on with Mary.
Yeah.
9:30, 12. It's just a process you can take back with you. Collect. Going in and just going through the process, sampling how to do this. Whatever you want to do, you have an idea.
Near limit.
Okay. So for those of you who have finished voting round 1, this is the final voting round. You should have, for the groups of 3, you have the top 2 ideas. And you can choose one by re-voting. So have you already voted here? You're going to choose one idea by re-voting. They're doing that in the back. They're doing it here. Choose who has finished. Have you done that? You've chosen one. And this threesome here, have you chosen the one? Got that to do. So this next step is for you. What you're going to do is, I'll tell you right now.
So who's going to go partnership? Okay, I guess I'm just trying to figure out how to do it. I'm going to get us out of this. So let me make sure this is yeah, with the blue book, we have that.
we're done. We got on order.
Yeah. Okay. Gotcha. Yep. What time do you think we're going to do lunch, right? We're supposed to be doing it. Okay.
bring that up here.
So we're done.
Totally the camper in the group. 11:44. 1 minute. Well, we got a practice. That worked great. Nancy, do you want to break it?
I'm with a company next it actually it's not stressful. It's like you've seen the art, you've seen
Okay.